A growing number of coronavirus infections in Korea are brought from overseas in recent days, and more passengers arriving in Korea are reporting symptoms, but airport quarantine facilities are in short supply. Many also point out that health authorities are not handling the situation properly.
Passengers wearing face masks stand in line to undergo airport quarantine screening. Some 6,000 people who arrived at Incheon on Thursday underwent special screening procedures such as temperature checks and installed self-quarantine apps on their mobile phones. However, the number of passengers reporting fever and other symptoms has risen sharply in recent days. On March 17th alone, around 360 people, or nearly 20% of all arriving passengers, had these symptoms. The numbers are expected to surge further as all inbound passengers are now subject to intensive airport screenings. But there are only 100 quarantine rooms at the airport, which is not enough to accommodate everyone with symptoms. Only some 840 passengers have been temporarily quarantined at the airport since early last month. Some passengers with fever who are allowed to go home after their specimens had been collected were diagnosed with COVID-19 later.
자차로 집으로 귀가할 수 있는 분들은 일단 검체 뜨고 일단은 집으로 가서 자가격리를 하라고.
When it comes to asymptomatic passengers, detecting infections is virtually impossible.
발열감지기 지나는 그 순간에 열이 나기가 어려워요. 잠복기가 14일까지 되기 때문에 대부분은 무증상으로 통과하죠.
Self-quarantine is not mandatory for those arriving from overseas. Moreover, health authorities can only detect infected cases when people with travel history self-report via mobile apps.
다 아니오라고 그냥 누르면은 되는 거니까 정말 이게 통계가 정말 제대로 이루어지는 건지는 모르는 것 같아요.
This week alone, 17 people from abroad were confirmed to have the virus. Health authorities are urging those returning to Korea from Europe and the U.S. to self-quarantine thoroughly for 14 days.